I'm Dr. Daniel Gruber. I'm a urogynecology specialist, director of urogynecology at Sibley Memorial Hospital. I'm an assistant professor for Johns Hopkins Medicine. I treat patients with pelvic organ prolapse or vaginal prolapse that can include the bladder dropping, the top of the vagina, or even the rectum dropping down. I also treat patients with overactive bladder or stress incontinence where they leak urine. And I work in conjunction with a lot of other services such as pelvic floor physical therapy, for pelvic floor strength, and treating patients to make them better with these issues. I provide a multitude of surgical options for patients depending on what their condition may be. This can include vaginal procedures, laparoscopic, robotic, and on rare occasions, open procedures. I try to do minimally invasive surgery so the patients have a better recovery and better outcomes. Those type of approaches are much better for the patient. They have much faster recovery times, the pain is decreased, and they're able to perform and go back into their normal daily activities much faster. A lot of women will come to me when they're having problems with vaginal prolapse, for example, and that's when the uterus falls down or comes out. And patients will notice this when it's coming out of the vagina typically. So it's a subjective thing. So when patients are starting to be bothered by the prolapse, by the vagina falling down, for example, they aren't able to do activities that they normally could do in the past, gardening, walking, exercise. Also, a lot of patients will be leaking urine as a result of these activities, and so they stop doing these kind of activities, and it gets very difficult for them. There's also a lot of patients who have overactive bladder, where they have a lot of urgency and then they can't make it to the bathroom. They might be leaking on the way to the bathroom. So we treat all of those kind of conditions to make their quality of life better.